This is an overview of the Minnesota Department of Human Services Waiver Reimagine program implemented January 2021. The objectives for this training are to define Waiver Reimagine, to be familiar with updated services and terminology, including some examples, to know which services have been updated and streamlined, to know where tools and resources are located for more detailed information. This is the first of a 4-part series. Feel free to review the other trainings at Waiver Reimagine, including day services, streamlining services, and the new service integrated community supports. Vision for the future. Waiver Reimagine will improve the overall disability home and community-based waivered system so that there's more choice and control over services, and it's easier to understand and simpler to navigate. That includes the right services at the right time, using the assessment to assess the services based on needs and addressing those needs, and being empowered with information and options. Waiver Reimagine has 2 phases. Currently, we're in phase 1, which started January 1st, 2021. It includes implementing the streamlining of services and a stakeholder engagement period for public comment. Phase 2 will be implemented after phase 1, which includes reconfiguring the 4 current long-term care waivers. The developmental disabilities waiver, brain injury waiver, CADI waiver, and CAC waiver will be combined into 2 waivers. It will be dependent on where they're living, if they're living in a licensed residential setting or their own home or family home. Budgets will be individualized to meet the person's needs. The project timeline started in 2017. The legislature required the Department of Human Services to conduct 2 studies to identify improvements to waiver programs for people with disabilities. In 2017 and 2018, the Department of Human Services conducted extensive research and stakeholder engagement that informed the Waiver Reimagine legislature report and provided recommendations. In 2019, the legislature authorized the Department of Human Services to simplify the service menu and continue analysis and research to reshape the waiver programs and individual budgets. In 2020, the Department of Human Services developed policies, procedures, and systems to implement a simplified service menu beginning January 2021. The Department of Human Services also continued to conduct research and extensive stakeholder engagement on reshaping the waivers, individualized budgets, and self-direction. In 2021, Phase 1 implementation began. Changes to simplify the service menu took effect on January 2021 after federal approval. The DHS, Department of Human Services, recommended policies to reshape the waiver programs and implement individual budgets to the 2021 legislature. For 2022 and beyond, after approval from the legislature, the Department of Human Services will submit plans for federal approval to reshape the waiver programs and individualized budgets. Implementation for those changes will begin in 2023 or later. Waiver Reimagine simplifies the waiver service menus. Waiver Reimagine project. In 2019, the Minnesota legislature authorized the Department of Human Services to make system-level improvements to Minnesota's disability waiver programs. The Department of Human Services will be making these improvements in phases. As part of the first phase of this project, the Department of Human Services combines similar services across the waivers to simplify the disability services menu, making the disability waiver system easier to understand. The following 12 services listed on the left column were streamlined into 6 simplified services shown on the right column. The older names for the services are on the left. Corporate foster care and supported living services are generally considered group homes or waivered group homes, and they will be called community residential services after January 2021. Family foster care and supported living services family will be called family residential services. The waivered services personal support and adult companion for support and supervision at home and in the community will be called individualized home supports without training. Independent living skills training, individualized home supports, and supported living services given in a 15-minute unit will be called individualized home supports with training. In-home family supports will be called individualized home supports with family training. And day training and habilitation services and structured day program will be called day support services. Day training and habilitation will be discontinued for day support services. Tiered services will be introduced. Tiered services mean the service in the setting has a higher standard for new people authorized to receive the services. The tiered service standards meet the home and community-based waiver rule regulations more fully and support community-inclusive service models for people with disabilities. On February 12, 2019, the Centers for Medicare and Medicaid Services, also called CMS, approved Minnesota's statewide waiver transition plan to bring settings into compliance with the federal home and community-based waiver rule regulations. Minnesota's statewide transition plan includes a plan to implement higher standards for new people, or tiered standards, for several services. The Department of Human Services submitted waiver plan amendments to the Centers for Medicaid and Medicare Services to implement the home and community-based waiver rule tiered standards in September 2020. The Centers for Medicaid and Medicare Services approved the Department of Human Services Brain Injury, CAC, CADI, and Developmental Disability Waiver Amendment packages in January 2021. Additional amendments: customized living, adult day and family day services, and pre-vocational services will all have added tiered standards. A brand new service called Integrated Community Supports will be introduced. There's a training just on integrated community supports available. The transition plan to implement Waiver Reimagine services and their vision, rolling implementation began January 1st, 2021. That means that anybody with a renewal after January 1st, 2021 would begin using these new services, new service categories, at their annual reevaluation or their annual review. At any annual reevaluation or annual review after January 1st, 2021, following federal approval of these new services and the department's completion of service updates, whichever is later, case managers must transition people from current residential or day services to the new services. So there's a lot of information to be aware of during that transition. For more information, feel free to Google Minnesota Department of Human Services Waiver Reimagine. There's lots of information there, including frequently asked questions and responses from the Department of Human Services on Waiver Reimagine. Also see the attachments that I've included with links for additional information on Waiver Reimagined.